So, as I mentioned before, schizophrenia and some of the mood disorders all fall in a category of disorders that would be medically verified, if you want to put it that way. So schizophrenia, mood disorders like bipolar, both fall into this category. And researchers have actually identified, and all of this is what we're going to talk about, is understanding schizophrenia. Researchers have identified some specific abnormalities in the brain, the actual neural tissue of schizophrenics. And essentially what they have found is there are brain abnormalities around and connected to increased receptors for dopamine. Abnormalities. And dopamine is the key, but there are too many receptors, so increased receptors for dopamine. That's one of the first ones that we have identified, and what we find is that certain medications that target this system seem to moderate some of the activity, some of the hallucinations and so forth. Modern brain scanning techniques indicate that people with chronic schizophrenia have abnormal activity in multiple brain areas. Out-of-sync neurons may disrupt the integrated function of the neural network. And again, when we talk about our functioning, it is in synchronization and it's integrated. And so the neural network's disruption is what is most noticeable in the brain activity of schizophrenic patients. And so some people, another aspect is enlarged ventricles, which is the fluid-filled areas in the interior of the brain. And apparently what we have found is that they have an enlarged fluid-filled areas, which means that if this is high, then what that means is that cerebral tissue has to adapt to the increased fluid in the brain, and so cerebral tissue is decreased. And that's just another aspect of it that on a neurological level would suggest some problems. Another one that's part of this is a smaller than normal thalamus. Now remember, with the thalamus, it's the circuitry, it's the circuit board, if you will, of the brain itself. And so if this is smaller than normal, then it would make sense that that would have some connection to the integration of the neural network itself. A possible cause for these would be a mid-pregnancy viral infection that impairs brain development in the fetus. And that's a hypothesis. It's not a lead pipe cinch, but it certainly is part of the backdrop of the understanding what's going on in schizophrenia. Another one that we have also identified is genetic influences, and the odds are really quite remarkable when you look at what happens within families themselves. You yourself have a 1 in 100 chance of any person developing schizophrenia. So 1 in 100 developing, schizophrenia. And that's just a random sampling of people. When we get to 1 in 10, so it drops from 1%, or I should say it rises from 1% to 10% if a family member has schizophrenia. You are at risk. What's even more remarkable, which you get even further, that's 10%. It jumps all the way up to 1 in 2, which would be essentially 50%. There's a 50% chance if your identical twin has schizophrenia that you will as well. So we have some pretty clear evidence of the genetic influences that occur in schizophrenia. Now, what about adoption studies? Essentially, adoption studies confirm the genetic contribution to schizophrenia. An adopted child's probability of developing the disorder is greater if the biological parents have schizophrenia. And so even with adopted kids, and they are adopted into a different environment, so, and their parents, their bio parents are, one of them are schizophrenic. So we can't really say that it's environment. Well, it certainly has a part of it, but bio parents, then adopted kids, their percentage goes up for schizophrenia as well. So again, it points to the genetic component that goes along with the development of schizophrenia. Now, as far as environmental factors are concerned, none have been discovered that invariably produce schizophrenia. Researchers have pinpointed some possible early signs in children. For example, the mother who has schizophrenia was severe and long-lasting. So possible warning signs, let's put it that way up here. Warning. The first one is mom with chronic schizophrenia. Birth complications, separations from parents, short attention span and poor muscle coordination, disruptive or withdrawn behavior. All of those, this one I just highlighted for you, but all of those are part of the possible warning signs for schizophrenia in kids, which means that we can mitigate against the untoward effects of schizophrenia by intervening early if we're able to identify the early warning signs of schizophrenia.